Welcome back. New at 4, a bill introduced in the Nebraska Legislature would help protect Nebraskans when receiving a colonoscopy.
LB 829 would close a loophole in the Affordable Care Act's language. 6 News' Aaron Hartley explains.
Introduced in the first week of the new legislative session was LB 829. Senator Carol Blood's bill would guarantee that patients with insurance would not be subject to additional costs for a medical service such as a polyp removal that's associated with a colonoscopy.
If you look at the language of the ACA, the intent was that people would be able to get their colonoscopies, and if something was discovered, that it would also be removed during that procedure. But the language has a loophole in it. So what Nebraskans would find is that during a colonoscopy, if something was discovered, such as a polyp, and it was removed, that their insurance was not paying for it.
Leaving patients to cover the cost themselves by hundreds or even thousands of dollars, or
there are going to be some people that make the decision not to have anything removed because they don't want that surprise bill. They can't afford that surprise bill.
Senator Blood argues that without the bill, it's costing insurance holders more.
If a person becomes sick because they refuse to go ahead and have that part of the procedure because they simply can't afford it, then we're going to have to worry about our insurance rates again because we'll be providing them services through our insurance.
Blood was inspired to put together the bill after having a screening for colon cancer herself.
And I started doing some research. I put out some social media, and I found that it is a common problem in Nebraska.
A problem she says could be fixed and in turn be life-saving.
Colon cancer is one of the top cancers that kills people in the United States. And a lot of it is so preventable. Based on the language that was put out by the ACA, we truly believe that this is part of a natural continuum, that this is the next thing in the process, that the loophole has allowed to happen at the federal level.
On your side, Aaron Hartley, 6 News.
Now, we reached out to the Nebraska Insurance Federation to get their take on the bill. They tell us that they support policy initiatives, writing, quote, "The health insurers of the Nebraska Insurance Federation support policy initiatives that keep policyholders healthy and reduce the cost of healthcare services overall, such as the provision of preventative screening services. Guidance from the United States Department of Health and Human Services already requires colorectal cancer screening without cost sharing. The Federation will work with Senator Blood to ensure that the colorectal cancer screening language in Legislative Bill 829 reflects the current federal requirements. The first hearing for LB 829 is set for Monday.